Good morning. It's July 23rd, and this is your daily brief in science. Here's everything you need to know. A recent study has uncovered alarmingly high levels of toxic PFAS chemicals in some reusable menstrual products, such as pads and panties. These chemicals, often called forever chemicals because they persist in the environment, have been linked to serious health issues including cancer, hormone disruption, and developmental problems. The research tested over 300 samples using advanced methods like particle-induced gamma-ray emission spectroscopy. Nearly 30% of these samples contained PFAS at levels suggesting they were intentionally added by manufacturers. Not all products had detectable levels, indicating that the use of PFAS is not necessary for product functionality. PFAS are used to prevent leaks and stains, but at least one sample from each product category was free of these chemicals. Currently, the U.S. does not require labeling for PFAS in menstrual products, though some states are considering legislation to address this gap. Industry experts recommend that consumers ask manufacturers about PFAS content, as specific brands were not disclosed in the study. The presence of PFAS raises concerns about skin absorption and potential long-term health impacts, especially for vulnerable groups like adolescents. Additionally, washing PFAS-containing textiles releases these chemicals into wastewater, contributing to environmental contamination. The study highlights a significant knowledge gap regarding the long-term effects of PFAS exposure through menstrual products, emphasizing the need for more research and transparency. A new study published in Environment International reveals that access to green spaces during pregnancy and early childhood can significantly lower the risk of neurodevelopmental disorders in children. The research analyzed data from over 1.8 million mother-child pairs enrolled in Medicaid between 2001 and 2014, using satellite imagery to measure vegetation around residential areas. The findings show that higher levels of green space are associated with lower rates of conditions such as ADHD and autism, especially in urban environments. The timing of exposure is important. Green space during preconception, pregnancy, and early childhood appears to offer different protective benefits, including reducing risks of autism spectrum disorder, intellectual disability, and learning difficulties. The study highlights that these benefits are more pronounced among children living in cities and among Black and Hispanic populations, pointing to green space access as a potential way to address health disparities. Researchers plan to further investigate the biological and environmental mechanisms behind these effects and how different types of green spaces impact neurodevelopment. Stefania Papatheodorou, the lead researcher, emphasizes that increasing green space in urban areas could support early childhood development and help reduce developmental delays. The focus of the study was on disorders such as ADHD, ASD, and other developmental delays, with particular concern for socioeconomically disadvantaged groups. A recent study published in Current Biology uncovers new insights into the origins of arachnids by examining Mollisonia symmetrica, an ancient Cambrian creature. This fossilized species, dating back approximately 500 million years, shows a uniquely arranged backward brain structure similar to modern spiders. Researchers analyzed the fossilized brain and central nervous system, discovering neural features that align with those of contemporary arachnids. Mollisonia had a segmented body with 6 pairs of appendages, indicating a predatory lifestyle during its time around 515 to 480 million years ago. Statistical analysis of 115 anatomical traits places Mollisonia as a close relative to modern arachnids, supporting a shared evolutionary lineage. The study emphasizes the importance of brain organization, suggesting that this backward brain configuration may have conferred advantages like improved motor control and hunting ability. The fossil also reveals a broad carapace and segmented trunk, traits seen in early chelicerates but indicating a more complex evolutionary status. The findings propose that early arachnids might have adapted to life in the ocean before moving onto land, potentially influencing the evolution of insects and their defenses. The research, led by scientists including Nicholas Strausfeld, re-examined a 1925 fossil from British Columbia, revealing neural structures previously overlooked. While the study highlights Mollisonia's role in understanding arachnid evolution, paleontologist Paul Selden notes that further research is necessary to clarify the full evolutionary pathway beyond spiders. A recent study from the University of Surrey reveals that nearly 44% of people do not wash their hands after using hospital toilets, raising significant hygiene concerns. The research highlights that hand washing is not as ingrained as many assume, especially in a post-COVID-19 environment. Hand hygiene lapses are more common during peak times, such as at the start and end of the day and during meal periods. Researchers suggest targeted interventions like signage, prompts, and behavioral nudges to encourage better hand-washing habits. Professor Benjamin Gardner emphasized the importance of using sensor data instead of self-reports to accurately measure compliance. He also noted that effective messaging can help establish lasting hand hygiene habits. Study author Carrie Newlands warned about the serious consequences of poor hand hygiene, including the spread of infections like drug-resistant superbugs. She called for innovative approaches beyond traditional posters and sanitizing stations. Both Pereira-Dowell and Gardner advocate for educational campaigns to improve hand hygiene among hospital visitors. Past efforts such as signage have only modestly increased compliance, indicating a need for more effective behavioral strategies. Low hand washing rates contribute to higher risks of infection transmission, particularly in vulnerable hospital populations. The German Federal Institute for Public Health recommends washing hands for at least 20 to 30 seconds and avoiding touching faucets with bare hands by using disposable towels or elbows. Deep-sea hydrothermal vents host microorganisms known as thermophiles, which thrive in extreme heat and lack sunlight. These microbes are collected through submarine expeditions that bring back heated fluids and rocks for analysis. Studying these organisms offers insights into early Earth conditions and the origins of life. Microbiologist James F. Holden from UMass Amherst focuses on these microbes, which resemble ancient lifeforms predating photosynthesis. The research helps us understand how life could exist in similar extreme environments elsewhere in the solar system. Moons like Europa and Enceladus are believed to have subsurface salty oceans heated by volcanic activity, making them potential habitats for extraterrestrial life. NASA's missions, including Cassini and the upcoming Europa Clipper, aim to gather data on these ocean worlds' chemical and physical environments. Analyzing samples from hydrothermal vents also aids in identifying chemical signals that could indicate life beyond Earth. Laboratory cultivation of thermophiles allows scientists to study their growth and biochemical processes, which have applications in biotechnology and sustainable energy. This research enhances our understanding of life's resilience and expands the search for life in the universe. This has been your daily brief in science. To read more about these stories, follow the links in the episode bio. You can also subscribe to these updates via email at www.brief.news. For more daily podcasts about the topics you love, visit brief.news/podcasts. Tune in tomorrow. We'll be back with everything you need to know.